Every woman is born with millions of immature eggs, which are discharged one at a time, usually once a month. This release of a mature egg from one of the ovaries, which happens every month, is known as ovulation. Ovulation normally happens around day 14 of a 28-day cycle, which counts from the start day of one period to the first day of the next period. However, the timing of ovulation can vary from cycle to cycle and from woman to woman. The time it takes for an egg to be released by the ovary and picked up by the fallopian tube, where it is fertilized, varies, but it usually happens 12 to 24 hours following a surge of luteinizing hormone. After 24 hours following ovulation, the egg is no longer viable, and you won't be able to conceive until your next menstrual cycle. But if you're not trying to conceive, birth control should be used at all times as a precaution. Whether you're attempting to conceive or just want to learn more about your body's ovulation signs, these signs and symptoms of ovulation will help you learn how to tell if you're ovulating, because this is when conception is most likely to occur. And the first sign we are going to talk about is mild pelvic or lower abdominal pain. Ovulation pain, sometimes called Mittelschmerz, is a painful sharp or dull cramp on the side of the abdomen where the ovary is releasing the egg. It usually lasts only a few minutes. Others, on the other hand, suffer from excruciating discomfort that precludes them from engaging in normal daily activities during their most fertile period. When a woman is getting ready to ovulate, her body creates more estrogen. This causes an increase in cervical mucus secretions and a transformation into a stretchy, clear mucus that looks like raw egg white. This watery, clear discharge helps sperm in swimming to the egg produced after ovulation. Tender breasts or painful nipples could be another sign of ovulation due to the flood of hormones being released into the body right before and during ovulation. Before ovulation, the levels of estrogen and luteinizing hormone rise. In some people, estrogen can stimulate breast tissue and cause breast pain. Shortly after ovulation, estrogen levels decline and progesterone levels rise. Certain individuals may have breast pain or sore nipples as a result of these progesterone alterations. Rapid hormonal changes that occur during ovulation may cause ovulation spotting. Brown discharge or spotting is common during ovulation. According to some women, ovulation spotting might be pale pink or reddish in hue. The presence of pink patches in the cervical fluid implies that blood has mixed with it. In the days coming up to ovulation, estrogen causes some women to have smoother skin and a brighter complexion. Some women may break out around the time of ovulation. Higher estrogen levels during ovulation can cause blood vessels to dilate, and when vessels dilate close to the skin appears more radiant. Mood swings are also prevalent during ovulation and are mostly caused by the body's hormonal changes. Premenstrual syndrome is a collection of physical and emotional symptoms that appear a week or so before menstrual period. Some people report feeling angry, while others report feeling bloated and achy. The cause is assumed to be hormonal changes in the second half of the menstrual cycle. During ovulation, the cervix may become higher, softer, and more open. Just before ovulation, the cervix pushes up higher, becomes softer to the touch, and opens slightly. When a woman is not in the fertile phase of her cycle, the cervix is lower, stiffer, and more closed. Some women may experience increased sensations as a sign of ovulation. They may get a more sensitive sense of smell in the second half of their cycle. This could be due to the fact that a female's body is programmed to be more attracted to the male pheromone androstenone throughout the reproductive period. Increase in the basal body temperature. Basal body temperature is the body temperature when you are at rest. Progesterone levels in the body rise after ovulation, causing the temperature to rise by roughly 0.5 degrees Celsius. On the days leading up to ovulation and on the day of ovulation, basal body temperature rises. These are the days a woman is most fertile and the time she is likely to get pregnant. Monitoring basal body temperature first thing in the morning before rising from bed and entering the data on a basal body temperature chart is a simple way to determine if ovulation has happened. Thank you for watching. If you found this video helpful, don't forget to give it a thumbs up and subscribe to our channel for more great content. And if you have any questions or comments, we'd love to hear from you, so feel free to leave them in the comments section below. Until next time, keep learning and growing.